Hey, future medics. Today we're discussing tonicity, and that's just a fancy word to say how a solution affects how water is going to move in or out of the cell. Now, I want you to remember this anytime you start an IV and hang a drip for a patient. It's going to affect the cells in some way or the other. And so that's why we don't just hang things to hang them. We think about what our patient needs and what this medication is going to do for them. Because if we get things too askew, their body is not going to work correctly. Now, you already have the foundation for all of this. So let's just put it all together in a nice little package that'll make it easier for your practice. Remember that water chases the solute. So that means that where there is high salt content, water is going to move to dissolve it. Okay? Tonicity is discussing where that solute is in, in conjunction with, compared to, there we go, the inside of the cell and how water is going to behave as a result of that solute concentration. There are three types of tonicity. The first one is isotonic. This means that the solutes outside the cell and inside the cell are equal. So everything's just going to stay exactly where it is because nothing needs to be changed. We see this mostly with normal saline and lactated ringers. Everything remains in balance. And so the fluid we give them mostly stays in the bloodstream because it doesn't need to shift any way to make anything balanced. This is great for patients who need that volume, the fluid to fix their volume problem. So like a trauma patient or a dehydration patient, this is perfect for those. Number two is hypertonic solutions. So these have more solutes outside of the cell than inside of the cell. And as a result, fluid is going to rush out from inside of the cell to the bloodstream to try and dissolve those solutes, which is going to cause your cell to shrivel down, like a grape turning into a raisin, very shriveled and dehydrated. Not a great state for the cell to be able to function in. So this is actually a problem. We only use it in very specific situations. So medicine, you'll see these for brain injury patients, patients with high ICP. The more that brain and the cells swell, the more pressure that unmovable cranial vault is putting on brain tissue, which can eventually kill that tissue. So we want to shrivel up those cells because they were way overswollen in the first place. So we want to shrivel them up to make more room so they don't die. 'Tis a problem, right? A normal solution that we would see that does this is 3% saline solution. Normal saline is 0.9% sodium chloride, but 3% normal saline is hypertonic. The third is hypotonic solutions. So there is more solute inside of the cell than outside of the cell, so water will rush out of the bloodstream into the cell, making it swell very, very large. The problem with that is if cells get too big, they'll burst, and then that cell is dead. If that happens to too many of our cells, we're going to go into tissue failure. Other things are going to happen. It's a cascade. It's a nightmare. So it's not very common in EMS for us to give this because it can get out of control quickly. But in the hospital, what you might see is half normal saline. So it's 0.45 normal saline instead of the 0.9. That one is a hypotonic solution. Cells rely on their shape, volume, and balance to function, especially neural and cardiac cells. So isotonic solutions keep everything the same. Hypertonic solutions will pull water from the cell itself. Hypotonic solutions will force water into the cell. The problem is, if cells can't function correctly, they die. And when enough cells die, tissues die. And when enough tissues die, organs die. And when enough organs die, your patient flatlines. All because salt and water were in the wrong place. So pay attention to medications and what their tonicity is and what is going on with your patient, because this is how you're going to do your absolute best for them, and it's going to be one of the few times in life that salt and water actually obey you. This is all coming together. I can tell. You're doing a really good job building a relationship between these tiny cell processes and these big EMS decisions that we make every day. So stick with me. You will get mastery without just having to memorize because understanding is how we remember things long term. You're doing a great job. I believe in you, even if you don't believe in yourself right now. I'll see you soon.